Hi and hello everyone, welcome to the Nursing Virus YouTube channel. This is me Loganathan and this video regarding the JIPMER Nursing Officer examination which was held on the date of 18/12/2022. I have already discussed first 50 questions in the two more videos. For those videos you can go and check it in my video description or in the video playlist. So you can see the first 50 questions with all the rationals and 4 options. So if you are not subscribed my channel, don't forget to subscribe and click the bell icon. In this video, we are going to see the rest of the questions with the suitable answers and the rational. Here we'll go with the first question. The detachment of the leading edge of the placenta and the entire organ slip down and out of the uterus sidewise. Dash and shining side of the placenta is dash. So here the options are Shut's baby and sludge mother, duckon baby and duckon mother. So here first we need to identify what is meant by sludge. So the sludge is in the sense the placenta will used to get separation in the center part. From here this area the placenta will used to get detached from the mother side, that is called as sludge. So here what they are asking is the leading edge of the placenta and the entire placenta slip downward and out of the uterus in the sidewise. So this point should be noted. So here on the picture itself you can see the duckon mean the placenta were getting separated in the sidewise and getting out. So the first two options will not come. So the option 3 and 4 will be guessable one. So here the another point is the shining side of the placenta. The shining side of the placenta will be always indicated the baby side. So the correct option is duckon and baby. The second question. The client received blood transfusion. The nurse assessing his respiration 24 beats per minute and pulse 84 beats per minute. And the blood pressure is 80/50 mm of Hg. And what is the priority care is given by the nurse? Though stopping the blood transfusion, inform the physician, administration of IV bolus of normal saline and continue the blood transfusion. So here the under vitals is the respiration 24 breath is normal and pulse also is normal. So the blood pressure is getting dropped down. So whenever if there is any changes in that circulation or in the blood reaction were happening, the immediate nurse's responses should be to stop the blood transfusion. Then you can go for the calling the informing the physician. If it is that circulatory overload is getting decreased, we will go with the normal saline and other inotropes will go. We won't continue the blood transfusion if there is any changes within the first 15 minutes of blood transfusion. We will not continue the blood transfusion. So option A is correct one. So next third question. A 64 years old man admitted with the symptoms of coughing, breathing difficulty and expiratory wheezing indicated which of the following condition? The chronic bronchitis, pneumonia, pulmonary edema and asthma attack. So here the identifiable symptom is the key factor is the expiratory wheezing. So this can be a kind of a direct question also. So the expiratory wheezing can be specifically seen with the asthma attack. Suppose if they are giving that productive cough, we can go with that chronic bronchitis. So if they are given any kind of an chest shape, so we can go with the other options. So here it is a direct connection. So the next fourth question. IV phylography used for renal condition to know about the shape and structure of the kidney and bladder and to measure the blood flow of the kidney, to measure the excretion of the urine, to check the specific gravity. So we all know that the pyelogram in that IV route will be given, that is to check the shape and structure of the kidney and the bladder. That means the entire urinary system shape and structure will be known. So the next question. The patient received that for the seizure disorder, he prescribed for the valproic acid. So what is that expected common side effect of this drug? So the 3 times diarrhea, vomiting and abdominal pain. So here the common side effect of the valproic acid will be the diarrhea. This is also kind of a direct question. That is a 3 times diarrhea will be the correct one. And the next question, this also belongs to that psychiatric side. In a school, the child is being noticed that he do some spelling mistake repeatedly in the writing. So after the detailed history, the child is well adapted socially, good intelligence in the solving the arithmetical problems, and talking with that everyone with a good manner and not having any other issue after the initial assessment. So the options: mild mental retardation, ADHD, attention deficit hyperactivity disorder, and specific learning disorder, and autism. So here we need to notice that the child have the good intelligence, so that MR will not come, and the child is well getting adapted and mingling with the others. That means not doing any kind of an adamant behavior or hyperactivity. So the hyperactivity also will not come. So in the autism, we know that the 3 key factor, the child will not communicate, socially interact, and do the stereotype pattern of behavior. So the child is doing that only some mistake repeatedly in the writing. So that is a specific learning disorder is the correct option for this question. The next one. In schizophrenia, client with the flat affect expected to show which of the following symptom. So the flat affect, we know that the flat affect is kind of an emotion related with the patient. So they will not express much emotion. So that is the meaning for the flat affect. So we can look the option. The experience not expression of not express emotion. It's an expression of an inappropriate emotion, expression of lack of emotion. So the lack of emotion is the kind of an apathy, and inappropriate emotions will be expressed in the mood swings patients. So the correct option is the experience not express of any emotions. So that is the flat affect. There is a no emotion at all expressed in the normal day-to-day activity. So the option A is correct. The illness is due to punishment of misdeeds is seen by which of the age group of the children. So they looked at the punishment, and so whatever the illness they get, they look as the part of punishment of the misdeeds. So that will be looked by the children in the toddler or school going or adolescents and infant. So commonly, so in that school going children's or the preschool children, suppose if they are given as the preschool children's, so that is also will be the correct answer. So preschooler and the school going children's, commonly they used to think that so whatever the illness they get, that is a kind of a punishment of misdeeds. So next one, the yearly puparium common complaint seen is incontinence of urine, urine retention, and edema or vomiting. So in that yearly puparium, so the incontinence of urine is very common symptoms we'll used to see with the mother. So next one, during pregnancy, the cardiac malformation of the baby seen in which of the condition? The rubella infection, herpes simplex, and syphilis. So the rubella is one of the dangerous infection during the pregnancy. So that's why we'll used to advise that. So whenever that mother even taking that rubella vaccine, will not advise to get conceived within a first 3 months or at least within a first month of the rubella vaccines. So the rubella infection will cause many malformation over the ear, baby ear, nose, or that cardiac system. They used to show the malformation or congenital problems. So it is also kind of a direct question. There is a rubella infection will produce much cardiac malformation of the baby. So which is considered as earliest sign of increased ICP. The nurse should closely observe the abnormal respiratory pattern, confusion to restlessness, increase the blood pressure from 90/64 to 140 per 50, and equal pupils. So equal pupils will not be seen. That is a dilated pupil only will use to see. The abnormal respiration, mainly that they are indicated the tachycardia, I think so. And the patient mainly will use to lose the consciousness when they are getting increased the ICP. So that is a confusion to restlessness will be considered as correct option out of these given options. So next one, the woman who admitted for the labor undergone cardiotocography and finding shows that the fetal heart rate decrease without each uterine contraction indicated that is a fetal bradycardia and early deceleration and late deceleration. So whenever the heart rate is getting decreased due to that uterine contraction, so that is the early deceleration. Suppose if the heart rate is getting increased, that is the late deceleration. So option B will be the correct one. So next 14th question. The child with the pulmonary edema and cardiac failure, person noted difficulty in breathing, and what is the additional symptom is expected on the assessment. So that pulmonary edema, and additionally they are added one more condition, that is a cardiac failure. So that crackles, decreased urine output, and CVP level changes. So on the pulmonary edema patients with a cardiac failure, commonly we can see the crackle sound during the auscultation. So next one, the patient develops intestinal diverticulitis after that patient's colostomy surgery. What is the expected observation in the stoma? So common procedure for that after that diverticulitis will go with the colostomy. So either it may be in that ileostomy area or in the ascending or descending colon. They'll use to perform this procedure. So that options are dark pulsation, dark, and that area is pulsable, and beef red color of the stoma. So here that dark and pulsation will shown mainly when the patient is not getting the proper circulation or getting infection. So that beef red color can be seen immediately. So after that colostomy procedure. So next one, the endometrium invade in the myometrium is known as adenomyosis, endometriosis, myometriosis, and placenta previa. So here the correct option is it's adenomyosis. So whenever that endometrium were getting slightly inward to the myometrium area, we'll use called as the condition is adenomyosis. So next one, so nurse providing care to the 11 months old baby with congestive cardiac failure. On the assessment, the nurse need to expect the additional symptom is weight gain, weight loss, and slow pulsation or a flat neck vein. So commonly, so whenever the person is having a congestive cardiac failure, we'll use to see the weight gain as one of the major symptom on the client. That is a gradual weight gain will be there. The next one, the magnesium sulfate during the pregnant woman is being administered. So which of the following will indicate that the patient is getting overdose of toxicity? So whenever the person is getting that magnesium, we need to notice the patient blood pressure and the respiration, urine output, and that reflex area. So whenever the reflex is getting absent, so that is one of the toxicity. So the reflex is present, so this option will not come. So that urine output will be considered as at least 30 ml. So here it is adequate, so this option also will not be considered. And whenever that magnesium sulfate is being administered for that eclampsia or pre-eclampsia patient, so the BP level also will be considered as normal. So the respiratory rate we are getting below the normal, that is a 60 to 24 we can consider as a normal. So here it is getting down. So according to the given options, this is the correct one. The respiratory rate is 12 beats per minute. So next one, the herd immunity not developed in which of the following? So the options are TT, measles, diphtheria and HIV. So that herd immunity in the sense, so the particular area people will develop the certain immunity for the particular disorder. So here for that measles, diphtheria and HIV, so somewhat they used to develop that herd immunity. For the tetanus toxoid injection, the person will not develop the herd immunity. The vaccine need to be kept in the freezer compartment, DPT, PCG, polio and DT. So this is the heat sensitive vaccines. We need to keep it in the freezer compartment. So that is between the minus 20 degrees Celsius. We need to keep that. Another important vaccines that they are DPT, PCG and DT can be kept between the 2 to 8 degrees centigrade. So that polio will be need to always kept in the freezer compartment. So the polio is correct one. The tetanus toxoid provide which immunity? The natural, passive, active or acquired immunity. So this is the direct question, that is tetanus toxoid will provide the acquired immunity. The next one, the neonatal mortality rate calculated by the death of the baby up to 1 year, 28 days and 6 months and 8 months. So the neonatal period will be calculated always between the 28 days. So between the birth to 0 to 28 days will be always considered as neonatal. So the neonatal mortality also can be calculated by 28 days of the birth of the baby. And the rabies vaccine not affected by the site of the dog bite, age of the person, depends on the number of the bite and animal species. So here that rabies vaccines used to get affected with the site of the bite, age of the person and depends on the number of bites. So the animal species will not affect the rabies vaccine. So the option D is the correct one. The next question. The patient with the diabetes insipidus showing the symptoms increased urination and being administered vasopressin. And what is the sign indicate effectiveness of the drug? So the diabetes insipidus, we know that the person used to have that polyuria, polyphagia and polydipsia. So the vasopressin need to be given to control those symptoms. So we can go with the option that is a urine output 500 ml in 24 hours. Here the person still have the polyuria. So this option will not come. And weak pulse rate and hypotension. So for treating that low blood pressure also the vasopressin will use to act. So hypotension will not come. And increased blood osmolality also will not be come in the case of vasopressin administration. So the specific gravity of the urine 1.015. So this is under the normal range. That is a 1.0.18 to 1.025 will be considered as the normal specific gravity of the urine. So this option can go for the correct working of the drug. And the next one, the men have history of weight loss, increased thirst, dry skin, and what is the most expected symptom of this person? Hyperkalemia, dehydration and hypocalcemia. So the person having the severe weight loss, increased thirst and dry skin. So this is all direct sign of the dehydration. So the next one, the measles can be communicated, so period, the 4 days before to 5 days after the rash. After the rash disappear, 10 days of infection. Measles incubation period between the 10 to 14 days. So between that period, so will be most comfortable to get communicated to others. So between the 4 days before to 5 days after the rash may be the most highest chance to get the infection to others. The next question, the patient with Alzheimer's dementia showed that being confused and irritable. So what is the nursing priority is given? That is first option, documenting and informing to the next shift nurse and administer sedatives and sending that blood for the lab investigation and check for the vitals for the physical abnormalities. So whenever the person with the coming with the Alzheimer's dementia, we won't go with the direct administration of sedatives, and the blood investigation also cannot be considered as much important. So the option 1 and 2 we need to think about. So here, so checking the vitals is that one of the normal part, but when the patient is getting confused, we need to inform to the other shift nurse. The nurse, other shift nurse also need to know about the patient condition to handle well and good. So the option A can be considered as right one according to the given option. The next one, the point source epidemic criteria is not seen in case affected at the short period of time and all the cases affected at the same time, and the case mainly affected depends on the duration in the short period of time. So the point source immunity will used to happen with the short period and the same time, and it's not depends on the duration. So the option C will be correct one. So this will not seen in the point source epidemic. So another question related with the sentinel index question. So it doesn't remember that options. So the next question, 29. The child undergone for the VP shunt. Immediately after the post-operative alert, the nursing action is so CSF fluid check for the protein and sugar and tachycardia and urinary output. So that after that VP shunt, so the client we need to check it out, either that how much amount of the fluid is being withdrawn. If it is an overfluid is withdrawn, the person go for the and shock. So we need to measure the CSF fluid for the protein and sugar will be the correct option. So next question related to the aptitude. That are 30% of the number of 3/4. So 30 and the 3/4 will be equal. The 3/4 in the sense the out of this thing. So the 3/4 75 we can consider, which is equal ratio for the both number is, that is a 2:5 can be considered as right option for this question. And the next, if 20% increase from the both side of the square, that is a 20% from the each side of the square, if it is getting increased. So what is the total area, the inside, so this area will used to get increased, that is around 44% area of this square will used to get increased. The next one, so identify the correct spelling of the following word, that is a bureaucracy. So according to the right answer, that option A, that is the correct spelling, bureaucracy. So he gave me dash unique idea, A and of the. So this is very simple question. There is a A-E-I-O-U. So based on the vowels, we need to select the option. So according to that A-E-I-O-U, so the correct option is an. So he gave me an unique idea. So next one, the year of the person in the Times magazine in the 2022. So this is the last month they announced. There is the Volodymyr Zelensky, who is the president of Ukraine, who is the person who is handling the war in a successful way. So this person is considered as that according to the Times magazine, the year of the person. The next one, the pipe can be fill the tank in the 6 hours, and the other side to empty the tank it takes 12 hours. If the both pipes are open, how many hours it will take to fill the tank? So just you consider that this is the tank. So we are inserting the pipe that will taking time for 6 hours. So it is by using the common sense also we can fill this answer. So the out it is taking 12 hours. For getting the complete filling of this tank, it is get 12 hours to fill the tank. The next one, 3 discounts on the page back is 10%, 20% and 30%. And what is the total discount the person will get for the single item? So we need to calculate, we need to reduce from 10% first from that starting price. Then whatever that amount we are getting from the first to second item, we need to reduce the percentage. From that second percentage amount to the third percentage we need to reduce. Just we can consider the 100 rupees. The 10% we need to reduce first. So we'll get that 90 rupees. From this 90 rupees, the 20% need to be reduced. So we'll get that around 72 number. Then from this we need to get 30%. So thereby we can make the total of all the discounts. So we'll get 49.6% as the answer. So in a classroom, the total 288 students, the ratio of the boys and girls is 3:5. And what is the number of the boys in a classroom? So here the total ratio is 3 plus 5. So that is considered as 8. So we need to take 288 divided by 8. So we'll get 36. So this is the common ratio. So then we need to go with the 3 ratio and the 5 ratio we need to take. So when you are calculating, the boys rate will come with as a 108 and the girls ratio we are coming as 188. So what they asked, so based on the ratio, what is the boys number? The 108 is the correct option. The remaining 2 will not be considered. So here how I calculated mean, after getting the 36, we need to multiply with 36 into 3. So option you'll get 108. And for that 5 ratio, 36 into 5. So this option you'll get 188. So this is the girls ratio and this is the 108 is the boys ratio. So this option is correct one. The next one, the compound interest of 15,000 for the 2 years, rate of 8% and calculate by annually. So I am not sure about this amount, either it is 15,000 or 15,800. So if anyone knows, you can give that in the comment box. So next question related to so which one of the following is not the bird? That is a penguin and bat. So another 2 more animals they given. So based on the option, so the penguin can be considered as not the bird. So out of this part 1, part 2 and part 3. So totally we discussed around 90 questions. So which they asked from the 100. So if anyone remember the further remaining 10 questions, you can write it in the comment box. So and based on these 90 questions, you can make the cutoff also. So most probably, so this time the expected cutoff surely will go with the 300 plus as the first mark we can expect, because the question is easy to moderate only. So thanks for joining with me and we'll see in the remaining video.